Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners disrupt the norm by throwing away the rainbow art and being the best you can be when working with older adults.
You know when you have those patients that don't want to put up handrails on the stairs or outside the house because they're afraid it'll make the house look ugly or make the patient look, quote, old? Well, I found these handrails from Promenaid that are super stylish, come in all sorts of finishes and colors to match any type of house. I like that they're super adjustable and you can literally put them anywhere, even those funky corners where the patient needs something but nothing ever quite fits. They ship quick and be installed right away, so we can adapt the home to what our patient needs fast, which is our number one priority. Check them out at Promenaid.com, Promenaid.com. Welcome, everyone, to the Seniors Flourish podcast. My name is Mandy Chamberlain. I'm an occupational therapist, and I always like to talk about everything to do with occupational therapy, and specifically working with the older adult. And so if you are new to the show, welcome. I'm so glad you're here. Today, we're going to be talking about inclusivity of the LGBTQ community. And my guest is Kelsey Reeves. She's an occupational therapist. Welcome, Kelsey.
Thanks for having me.
Oh, this is going to be a really great topic because I think sometimes people feel like they need to know more information. They don't know where to look and what they need to know. So I think this is going to be such a informative topic where people can get some really good information. So I think I'm just glad you're here so we can discuss it.
Yeah, I'm really excited. And I think that no matter where you're starting, if you're like, hey, I know nothing, but I want to learn, or you're like, I'm pretty experienced in this and I just want to know more and how I can apply it. Hopefully we can address all of it.
Perfect. Good. Well, let's get started. So talk about your OT journey, kind of how you found OT and kind of what you're doing currently.
Yeah, so I'll kind of start with now and work my way backwards. I think that's a little easier, or at least it makes more sense in my head. So currently, I'm working as a travel occupational therapist. So I've been in a variety of different settings, mostly in the older adult population. I graduated about a year ago, and I was one of those super ambitious new grads that went straight into home health. So that was my first assignment. And that's kind of how I discovered the podcast, is I just had all these hours in the car. And so I started listening to all different types of podcasts and ran across yours and just totally fell in love with it. So I'm very excited to be here now.
That's awesome.
I got involved with this particular topic actually when I was a student. So I went to school at Augusta University in Georgia. And they have a variety of different health clinics. They're free for the community members. They're mostly run by the medical students. And they're for anyone that is under or uninsured and falls 200% below the federal poverty line. And so the two classes ahead of mine had worked really hard to get the OT students involved in one of the health clinics called Equality Clinic of Augusta. And most of their patient population, about 70% at the time, I don't know now, are transgender. So that's kind of where my experience with this topic and population comes from, was working in that group. We started just as a group of volunteer OT students. Some of us worked coordinating the mental health services. And then the rest of us kind of did a needs assessment to figure out what the clinic needed that OT could provide. And we ended up running like a support group during this time while the patients were waiting for their medical appointments.
Oh, wow.
Yeah, that's kind of where I started.
Program.
It was an amazing experience, and we just took it and ran with it. And then when we went, on our different field works and to different places, we just saw the lack of education in this area. So myself, as well as the classmates I worked with, I will give them credit. They're all wonderful and wish they could be here with me. But we ended up presenting at AOTA, and we're kind of working on potentially an OT practice article just to get the education out there.
Oh my gosh. Yeah, that sounds like such an amazing experience and sounds like a need, a need. Was it just basically an unmet need that you guys just decided to fill? Is that kind of?
Yeah, absolutely. And just within the area, there is no services, particularly for individuals who are transgender. I mean, we would have participants in our group drive from 2 and 3 hours away just to be able to come to these appointments. And they would all carpool together and take a whole group and come down. And so there was just not a lot of services. And we found through kind of talking to the people that were coming to clinic that they really didn't have a space where they felt safe to bond with other people that were similar to them or had some similar experiences. So that's what we wanted to create. It's just a way to facilitate relationships and a space to talk about it. So, yeah.
Wow. That is amazing. I love that. I love that. I love it. So
it was so fun.
Yeah. Gosh. And okay, so let's just back up. Like we were saying kind of like at the intro, maybe this is a topic that people have no idea. They haven't learned a lot about it and they're really curious and they want to feel informed. Let's just start kind of at the beginning, as in, let's just kind of define who is included like in the LGBTQ community and what does that look like? So we can just have some like foundation.
Yeah, absolutely. And I think if that's, where you are and where you're starting, that's great. Like that is completely okay. When we started with the Equality Clinic, we had all different experiences. And some of us were at that place. Like we were like, we are interacting with these individuals and we have no experience, but we want to learn. And a lot of our education came from the people we were working with, as well as doing our own research. So that's kind of where I'll start explaining. So LGBTQ, we'll just start with the basic acronym. It's kind of an umbrella term, just a shorthand. There's a lot of different initialisms for this umbrella of people. Is initialisms a word? I don't know if that's a word. I might have made that up. But it stands for lesbian, gay, bisexual, transgender, and then the Q can either be queer or questioning. Different people define the Q differently. Queer is one of those terms that some people use and identify with, and then some people find that offensive or might be used as a slur. So I always kind of add that in as a cautionary term and make sure someone else is comfortable using that term before I would use it.
Okay. And then how about even just talking about, so we're just talking about, we're doing the basics. We're starting with the basics. Okay. So can we talk briefly about, I think the other thing that I know some people have questions about are things like the difference between maybe like biological sex versus like gender identity and gender expression and sexual orientation and those kinds of things. So let's go through so we can kind of understand like proper language. So when we kind of like start talking a little bit more in depth about it, that people have a good understanding.
Okay. Yeah. I think that's a great place to start. So we'll start with biological sex. So biological sex is the sex you're assigned at birth. It's what's recorded on your official documents. It's the sex organs you have, your chromosomes, your hormones. It's kind of what you were born with, the body parts you have. So within that spectrum, there's male, female, and intersex. And then that, so I think, does that mostly cover that biological sex? I think I got the big parts for those.
I think so.
Okay. So then gender is more of a socially constructed system. And it's kind of what we as a society describe as what is masculine versus feminine. It's this pattern of like social arrangements that kind of govern our activities. And these things change. They vary by culture. They can be very different. So I like to give the story of, when a baby's first born and they announce it's a girl or it's a boy. And for some unknown reason in the United States, we grab a particular color paper to go stamp their footprint on or whatever. So that's kind of the idea of gender. Okay. Whereas gender identity is how you as a person feel and express or how you as a person identify with your own gender. And this does not have to be congruent with your biological sex.
Okay.
So, everyone has a gender identity, but this is a spectrum. It's a whole continuation that people flow somewhere along this spectrum. So some different gender identities would be man, or someone who was born a male and identifies into the male. Trans man is someone who was born a female but identifies as male. Gender queer or gender fluid is someone who doesn't really identify with either. They're just somewhere on that spectrum. Trans woman is someone who is born male but identifies as female. And then woman is someone who is born female and identifies as a female.
Okay.
Am I going too quickly?
No, just absorbing it in.
I know. If this is like new, it can be a lot to wrap your head around just to kind of sit down.
No, it's true. It's true. It's the thing. It's like trying to get a good understanding and thinking about how, like, what your body parts are and what your identity is, and in your brain, and then how you feel about yourself, what you're oriented. It's like,
right.
I think, it's trying to figure out like how that looks, looks as in the point of someone's expression and what that is, because it's all about learning and trying to figure it out. But you also, and I'm going to add a quick little note in here before you move on to the rest of it, is that Kelsey is going to provide this amazingly beautiful handout. So I'm going to add that in the show notes. I'm going to put it in the blog post, and you can print it out. And it goes over all of the areas that Kelsey's talking about, and it has a wonderful like little graphic, and it shows it. And it's just, if you are a visual learner like me, it really helps you understand exactly what she's talking about. So we went through biological sex, gender identity. Okay. How about gender expression?
Yeah. So gender expression is how you portray your own feelings about your gender, or how you portray your gender identity to the rest of the world. So these things are done through stuff like dress, how you behave, how you speak, your mannerisms. And they're also just a spectrum. And a lot of us fall like somewhere along that spectrum. And I know for a lot of people, it like varies by the day. And some people it depends, and this is where I always get into like, this is a huge umbrella of people, and people identify differently. And that's why we have to kind of see how our clients like view themselves. But some of those terms for gender expression can be masculine, androgynous, which is like someone who gives off both masculine and feminine expressions, feminine. And then other terms are gender binary or gender nonconforming, which are they don't identify or conform to any particular gender expression.
Okay. Makes sense. Okay. How about like sexual orientation?
Yeah. So sexual orientation is a, totally separate topic from that.
Yes.
And
it really is.
Yeah. So this is a term. It can also be used as sexuality or sexual identity. And this is who you want to be emotionally or romantic or have sexual desires for.
Okay.
And this is not necessarily someone that you would like engage in a sexual relationship or sexual practices for, because, not everyone engages that. There's also people who are asexual and things like that.
Yeah. Okay. I think it's good to just kind of go over some of the basic terminology of people. Like I said, if it's kind of like a new to someone. It's kind of just like when I was doing my research, doing just some research on statistics and looking at members of the LGBTQ community and discrimination in healthcare. And it's such a huge, huge topic. Like, I mean, we could this is way more than an hour, but we're going to squish it into an hour as best we can. But I mean, looking through some of those stats of like, what are some of those stats? Do you have any of those?
Yeah, I do. I have them right here, actually. And they're all provided on the handout, especially if I throw out numbers and I've totally lost you, that's okay. We'll come back in just a minute. Just hang with us. So in healthcare, there's a study. It was in 2010, and I looked for a more updated study, but this has been recited, and I couldn't find one that was more updated. But Lambda Legal did this study looking at healthcare settings, and they found that 56% of lesbian, gay, and bisexual people and 70% of transgender people had been refused healthcare. They have been blamed for their health status, experienced physical as well as verbal abuse by a healthcare professional, and had medical staff refuse to provide care. And when you think about it, that's awful. And if you had those experience, or if anyone who's listening has had those experience, like, it's understandable why you would be apprehensive about sharing and opening up to a healthcare professional, or even attending, a session or going to a doctor's visit, and particularly for our older adults, because they've oftentimes experienced a lifetime of this discrimination.
Well, and then I was reading some of those other statistics that they say they're estimating about 1.75 to 4 million American adults over the age of 60 identify as LGBT. And so, first of all, that's a chunk of our society. Second of all, it's super interesting to me that they have their estimates are 1.75 to 4 million. That's a huge gap.
And part of the issue with this is it's super underreported as well, because if you have all these negative experiences, you're probably not going to feel as comfortable with sharing that information, or may not be sharing that with anyone.
Yeah, that's exactly what I was thinking when I read that number. I'm like, that's a pretty big gap. Like, because, but if you're, like you say, if you're discriminated against, like, why? Yeah, it's completely understandable that you're not going to disclose some of that information if they feel like they are not going to get the care that they need and are required to. And it's ethically, it just blows my mind. But even things like you're talking about the stats about, physical and verbal abuse. The whole thing is just, it's just not me. So it's just like, I can't even understand it. But like a healthcare provider we're here to care and take care of people. And it's just like, I don't know. It just makes my blood boil, for one.
It was, I've seen, this abuse towards people, and it was really hard. And it was something that, because I felt so confident in my knowledge on it, I was able to advocate and say, this is, not how you should treat this people. These are the things you should be doing. And some of it is done unintentionally, and I understand that, but sometimes it's also intentional and just downright mean.
Yeah, plain discrimination.
And it's terrible and just so sad to witness, which is really one of the things that got me so passionate about this topic.
Was it, now I'm all like curious, was it like another healthcare provider? Like,
it was, and it wasn't OTs. I'll give OTs credit. I have, at least in my experience, I hadn't seen an OT have this interaction, but other people on the healthcare team, just intentionally using, someone's incorrect pronoun or name and not addressing them as they would like to be addressed, or saying, I'm not willing to provide services for you. That I didn't, personally witness that, but I have had friends who are transgender share that experience with me, that they've been, to healthcare providers and been turned down.
Wow. Wow. I mean, and just kind of looking also about older adults, LGBTQ older adults, kind of looking through some of the research and just talking about their higher risk for social isolation, conceal their sexual and or gender identity to healthcare professionals for fear discrimination, have less caregiver support or options for informal care, have higher risks of mental health issues, disability, higher rates of disease, and physical limitation than their heterosexual counterparts. It all makes sense because of the discrimination, and they may not getting the care, or, it's that whole kind of cycle. They don't feel like they're going to get the care, and then they don't go in to get the care, or they don't disclose. And it's just like, oh man, it's just wrong. It's just wrong. So like, okay, what is our role? Okay. So
what do we do?
What do we do about it in our, what in our little practice settings? So we talk about, using inclusive language. Let's just start there. Inclusive language. What is inclusive language? And can you describe kind of what that means?
Absolutely. So for me, this is the basics of it. The core of it is using the language that the client uses. And we say that all the time as OTs. Like, that somewhat comes natural to OTs. Like, in the same sense of, if a client calls it a toilet, we call it a toilet. If they call it a pot, we call it a pot. Like, That's just our natural thing, is to listen to the client's language and utilize it. So carry this over, because using the client's language in this situation has large implications, and not using it definitely has large implications. So that's just the basics, is using the language that they use, and being open about how they identify.
So
some examples for that.
Yeah, like let's get some examples, so people will be like, that sounds great. Now, okay,
yeah, sounds good, right?
Yeah.
So for me, one thing I do is, when I go in and I'm like working with a client for the first time, or maybe it's evaluation, or I've never worked for them, I just walk in and I'm like, "Hi, I'm Kelsey. I'm an occupational therapist. What's your name?" And some people still give me their full name, and I say, "Okay, what do you like to be called?" Because the basics of just like, of what it is that you want to be called, or it is your name. So I should be using this. And this goes for everyone, not just people within the LGBTQ population. Like, some people will have a shorter name or a nickname, and that's what we use.
Right.
So that's like, just across the board, that's where I start, is using the name that the person prefers. Or not prefers, but the name that they use. The preferred name is a topic that I am guilty of, that I was doing incorrectly. I was always kind of referring to it as someone's preferred name or preferred pronoun. And then someone pointed out to me that this isn't a preference for them. This is actually their pronoun. And so I've tried to correct myself. And that's where I'm, I'm still learning. And I've been involved in this, and I'm still having to learn new things. And this language is always changing. So just trying to stay current. But really, the easiest things to do is to ask the people you're working with.
Okay. That's a very good practical example. Okay. Well, what about, what are some other things? Okay. So you start out by introducing yourself and asking them, and it sounds so obvious. Like you were saying, like, as OTs, you feel like, oh, we're client centered. Like, we need to use the language, but like it may not even be intentionally, but, just trying to have, like you say, more inclusive language and have that communication open from the beginning.
Yeah. Absolutely. And just avoiding assumptions about that client, when you walk into someone's room and someone's visiting, not assuming that might be, their sister, and they're like, "Oh no, this is my wife." Just letting them kind of introduce that, or this is my neighbor, and you're like, "Oh, well, that was awkward."
So that's how I know that I've done it. You just I remember, it's like a way younger wife, and you're like, "Oh, your daughter," and you're like, "Oh my gosh, I'm such an idiot." And you're like, "No, it's my wife." You're like, "Oh,
yeah."
we're going to put our feet in our mouth all the time. Like I should say all the time, but it's going to happen.
Yeah. And we can talk about how to, correct those mistakes and everything too. But, that's a big thing. It's just avoiding assuming and avoid using those gender stereotypes of, just because you present to me as male, then I must present you with these types of activities or assume that you would have these interests. But keeping that open.
Right. Yeah. Those are the things I think are sometimes challenging, especially if from my own experience, I live in a very farm community. And so you feel like, oh, the guys don't want to do this but that's not being client centered either, and that's making an assumption. But yeah, I can see how definitely that happens. And just like I think when you're more aware of something, like being more conscious of a situation or making sure that you're trying to be more inclusive, I think that helps. It's just like that awareness. Cause sometimes it's like, I didn't even know. I didn't even pay attention. It wasn't even on my radar. It wasn't ill-intentioned or anything like that. But it's like, just even being aware of that and trying to just think of it a little bit differently, I think is really super important. And it's a step in the right direction.
Absolutely. Yeah.
Absolutely. So what are some practical strategies? So we started with some like inclusive language. You gave some good examples for that. What are some other things that we could implement into our practice to kind of be more open and show that be more inclusive?
Yeah. Some of those things are just like environmental things, stuff around you. Like, what is on your little pamphlets or, education materials that you have? Are they inclusive? If it has pictures of couples, like, do you represent different types of couples and different types of relationships? Just having those available and just showing that, like, that there are, other, materials out there. I don't know where to go with that, but yeah, basically just having a variety of materials that represent different people.
Oh, I think you're exactly right. Cause it's actually, there is, oh man, I'm going to have to pull it up, but there is a website that, cause if you look up for OT in general, like if you look up OT, like position handouts for patients, if they're, almost all of them are male, female. And so, I had been looking for, like just kind of like non-discriminate, just like not male, female, not, just like trying to have
just like general figures,
general figures that I could have, like, so I don't have to have 500 different, like papers, but I found all of them. So, but they are out there and I'll link if I can find some, because I think those are important to have. But you do have to kind of dig because there's not a lot out there. So if anybody's like artistic and wants to like create some handouts, it would be really helpful. But
I feel like there's so many times that I'm creating my own stuff because I'm like, oh, I like a piece of this and a piece of this. But yeah, it is hard. It does take more digging sometimes of finding those handouts that represent the people that we work with.
So things like, just like that, and handouts. How about you were talking about the environment? Is there anything else in the environment that you think would be helpful?
So one thing I do that's like super simple, because I change up my environment as a travel therapist all the time. Like almost every 3 months, I'm in a totally new environment. And so I have just like a rainbow pin that I just pin onto my badge wherever I go. And it's just like my little sign of like, I am open and willing to talk about this information and open to you sharing. And a lot of people that are LGBTQ look for those rainbows or look for those signs in an environment, in the environment that say like, this is a safe space. I can, disclose this information here.
And such an easy way to do it too.
Yeah, so simple. And most people like probably don't even notice it. But I actually had a client ask me about it. And we were working on some stuff with sexual activity, and she shared her, whole experience with me and some of the discrimination she had faced. And it was valuable information for me to know as her OT, especially as, we were addressing the topic of sex.
Mm-hmm. Oh, wow. Yeah. And that's something so easy can make someone feel like they can trust you and feel open.
Yeah. Absolutely. Yeah. And even if it's just, that trust in the relationship that, can just really build that therapeutic relationship. If you're someone I can trust, even if we're not directly addressing some of these things, but just that you're someone I can trust.
Mm-hmm. Yeah, definitely. What are some other things that you feel is helpful in creating safe therapeutic relationships? Or how do we foster that?
I think really just listening to your clients and listening for what they have to say and their life experience, especially in this older adult population who has experienced so much discrimination and maybe aren't comfortable sharing, and just meeting that client where they're at on their journey, and, not forcing someone to share or not to share, but just providing that you are a safe space for sharing.
Mm-hmm. That's good. That's really good information. I mean, I feel like that's some of the things is you maybe as a OT clinician, that's something that you really want to portray, or you are an open person that you want that patient to feel that trust. But just having those little tips, putting rainbow on your name badge, or, having don't have those assumptions, or introducing yourself and asking how they want to be addressed, or, talking about maybe, they talk about what kind of pronouns they want to be, addressed as, or those kinds of things. I think are just such an easy way to show that, because sometimes we think that, but we don't necessarily portray that. Not in a bad way, but it's just there's no identifying way to say I can be trusted in that. And then,
right, and I think those come from those subtle things that you do to say that, I, can be trusted with this information, and just, building that therapeutic relationship over time, if you have it, for the client to trust you.
Mm-hmm. Yeah, I can definitely see that. How about I saw some information about those culturally inclusive forms. So I thought that was pretty interesting, because that's something I definitely know that, and none of the facilities I work in have that. And so I'm interested to learn more about that, because I would love to kind of suggest something like that.
Yeah. So it's hard for me because I'm in and out of facilities so much to really change something like a new form. So I sometimes forget about those things, but thanks for reminding me. So so culturally inclusive forms. This is just saying have enough boxes for everyone to have something to select. Yeah. So, I mean, that's it. It's under so pronouns. Obvious. Right. Because a lot of times and I get so irritated because I go to doctor's office and I see sex or gender even incorrectly, and all it'll say is male and female. Yeah. And there's no other options for anything else to be listed. Transgender, trans male, trans female. It's just male and female. So that person is automatically okay, well, what do I check here?
Yeah. Yeah.
Or it's just listed as spouse. And people are in, long-term committed relationships, especially as OTs. We think about their caregivers and who's going to be assisting them and, helping them at home maybe. So who is that person? Not just, maybe a spouse.
Right. Right.
If I have actually an example intake form that I can send you if you want to include it on the show notes, if maybe anyone else is at a facility that they would want to use it. And it has space for someone's name that they use as well as their legal name, because sometimes, in the healthcare setting, we have to know their legal name because that's how they're listed in the chart. And there's just reasons why we have to know that in our heads somewhere, because that's where we're documenting or something. But also having a space for the name that they use. It includes multiple options for gender, as well as a space for someone to write their pronoun that they use.
Okay. Oh, yeah, that would be great. I mean, even just like to have some examples. I think those are the things that are helpful. As someone who is a visual learner like myself, I like to be able to see it.
Yeah. And a lot of this stuff is so visual, and I'm like looking at it. So I'm like, I hope I'm doing a good job of describing it as I'm looking at it.
Oh my gosh. Yeah. No, I think it's just those things, just getting the conversation going and making us think about like, how are we serving our clients to the best of our ability? Are we being inclusive? And if not, what are some things that we can do to be proactive? I think that's kind of most important. So how do you ask about addressing your clients, or top tips to being respectful? Because I mean, maybe you guys haven't, but I've definitely made the mistake of using incorrect pronouns or making assumptions when I shouldn't. And it's all a learning experience, right? So like, is there a best way? It's like this awkward, you're like, sorry about that. It's just this whole thing.
Yeah, no, and I agree. And it's something that it can be hard to ask. I feel like the more I ask it, the more comfortable I get with it. Something I do is I just ask it like as I'm asking like orientation type of questions when I'm first getting to know someone. So I include it almost like, oh, this is a checkbox that's on my form. Let me ask about this.
Right.
So that it feels less awkward. Like it's like, oh, this is the next little box I have to fill in to get that information.
During like an evaluation or what, like or when you're first kind of meeting them. Yeah.
When I'm first meeting someone during an evaluation. And other things is just listening for how they refer to themselves. I'm just kind of listening out for that and then, using that. And another thing with pronouns is some people use different pronouns depending on the people they're interacting with. So you also have to be careful when you're, maybe interacting with others, training caregivers or whatever you might be doing, because they may not be comfortable sharing with that person. So if someone does provide a pronoun, then I always, ask that person before, is this, the name you use or the pronoun you use with this individual? Like, how would you like to be addressed when, we're working with someone else, to avoid unintentionally outing someone, so to speak. Right.
Okay. So what do you think you would, in those situations, like I was saying about like, do you suggest we correct ourselves when we address a client incorrectly?
Yeah.
Do we is it more uncomfortable for like me? Is it more uncomfortable for me, or like, it's just, I don't know. These are the things.
It's uncomfortable for everyone. Like, I've done it. Like you're like, oh man, I was working on this. I'm trying so hard. I want to be inclusive and I made a mistake. It happens to all of us. We make mistakes. And the best thing that you can do is correct yourself and say, I'm sorry. And then, use the correct terminology, whether that's their name or their pronoun, and then move on. It's unfortunate. It happens. Just say you're sorry, correct yourself, and it'll be okay.
Yeah. I completely agree. And that's exactly what I do. But it's like the whole thing. It's like, you just feel like, dang it.
Oh yeah. It like ruins my day for like the rest of the day. I'm like, oh man.
Like I'm trying, and then it feels weird. I mean, I just, because I'm kind of like that self-reflective person. Like sometimes I maybe dwell on things longer than I probably need to or should. It's that whole thing. It's like you're really trying hard, and because it's not always natural for me personally, it's not always natural. And so like, I'm really trying, I'm trying, and then you've just like, man, jeez. But you just have to move on because it happens to everyone all the time. And
Yeah,
at least I feel
happens.
like, you make it an effort, like trying. It's because I feel like personally, I just feel like there's so much to learn, and it is, things do change, terminology changes, and like you say, depending on the setting and who they're talking to or who they feel comfortable with, and it's like just really trying to be aware of and being sensitive to what your client wants and needs. That's what we always try to do, right?
Right.
But it's just for me, everything, I shouldn't say everything, but OT in general is very, very smooth. I've been doing it long enough now. I'm always learning something, but I have enough experience under my belt. I've seen a lot, but it's those situations that we always have to keep learning.
Yeah, absolutely. And this is just a topic that's ever growing and ever learning. And most of it sounds so simple. It's like, oh yeah, that's being client centered. I can do that. But it's just having that extra awareness of, oh, this is a thing. Let me, implement some of these strategies.
Yeah, no, you're exactly right. I think just becoming more aware. I think it does help when you can just have just raising awareness and talking about, the LGBTQ community and having some more insight and looking at strategies and things that we can do in our own practice, to help alleviate some of those disparities that they experience. Because, the research shows that, there is a lot of stigma and discrimination, and it's like, what is our role in it, and what is our part to help alleviate that and help be the change a little bit, be the change. But it's true. It's like you have to just do it,
And some of those things, a lot of the strategies we talked about are stuff you yourself can implement. Some of it, like inclusive forms, are things you can be advocates for, or just when you're working with a client, advocating to the other people working with that client or your team that, I know you maybe didn't intentionally do this, but this is the name the person uses.
Yeah. Advocate, right?
Yeah.
Is there any additional websites or resources? You are providing a really great overview that, like I said, I'll put in the show notes. But is there any other resources that would be helpful for listeners if they're just wanting to learn more and feel more comfortable and provide that client-centered care?
Yeah. So one of my personal favorites is the Safe Zone Project. So it's thesafezoneproject.com. They have amazing resources. It's actually where I got most of the graphic pictures on the handout. But all of their resources are available. They have a huge glossary of terms that you can just look up, like, hey, I don't know what that means, or I'm still wanting to know more about this. It's a great place to start. It's really well laid out. They also have online training. So it's like a 2-hour online training, and you can be Safe Zone trained, and they will send you 6 stickers and a couple of things in the mail. And then that's just stuff you can use to kind of let clients know that you are a safe space. So that's a really great resource, is the Safe Zone.
Oh, wow. That is great. Okay. And I saw
really
you
big one.
Go
ahead, sorry.
Go for it. No,
really big
I got
one
excited. See, I got more excited. Go.
This is what happens when OTs get together. We just get really excited about OT.
So true.
But the Human Rights Campaign is another really great resources. They're one of the largest advocacy groups in the United States. They do a lot of research in this area, but they also have a lot of great resources and trainings and more information to look at.
Okay. So I saw you added some of these resources to your beautiful handouts that we're going to be adding. But I and that's the thing. It's like, I think the 2-hour training thing, I'm going to check that out, because I think I always want to learn more, and I feel it's important that we always learn more. But having those additional resources and having good resources, I think makes a big difference. It sounds really obvious, but there's a lot of, not even just about LGBTQ communities, but just in general, not that great resources. So it's nice to have those lists of quality, resources that you can go to find the stuff that you need. So thanks for adding those.
SafeZone is my go-to whenever I'm, unsure about something or want to do some more research or kind of update my language and terminology. I go to the SafeZone project.
Perfect. Okay. We're adding that. I'm adding on the show notes. So is there any key takeaways that you would say in general, just overview, if you are an OT practitioner and you're not feeling overly comfortable, with patients that are in the LGBTQ community and they're looking to learn more, and like you say, those takeaways that you feel okay, this is where you need to start.
I think the biggest thing is, just listening. I mean, you've already started. You're listening and trying to educate yourselves and learn more. That's a great start. But the biggest thing for me is always using that client's language and being client-centered.
Yeah. Perfect. Okay. Great topic. So we're going to add in the show notes and on the website, we'll do, put all those resources for those, websites, SafeZone Project, Human Rights Campaign. We'll add in Kelsey's, handout. We'll do, some links. So if Kelsey, if you want to send over that example of the intake form, I'll add that as well. Cause I think that'd be really, great to see, how people or how an organization has, included inclusive language in their intake forms. I think that'd be really helpful as well. Because even if you can't change, your healthcare providers overall paperwork, you might be able to do it even just using the language maybe in your rehab department, or even just during your evaluation, having some key terminology and things like that, making sure we're having inclusive terminology. So
I got some. And I included my email. I included my email on that handout. So if anybody has any questions or even feedback, comments, I would love to chat. So feel free to shoot me an email.
Awesome. And I'll add that also in the show notes. So thank you so much, Kelsey, for talking with us today about this topic.
You're welcome.
All right, guys. If you have any questions, email Kelsey. Check out all the resources we have today. And we will be talking to you next time. So, all right, guys, until next time.
Do you feel like you're navigating the OT world without a map? Not feeling confident or competent in your day-to-day treatments and struggling to apply your knowledge clinically? Then be sure to check out the Seniors Flourish Learning Lab membership. It has all of the treatment ideas, patient handouts, clinical resources, community support, and mentorship you need to succeed. Join today at seniorsflourish.com/learning lab.